and welcome back to the Advancing Healthcare Innovation Show. And I'm your host, Michael Stamatinos. And if you're new to us, man, we're great. Feels good to have you here. And we're bringing some really exciting conversations with leaders that are painstakingly shaping the future of healthcare. And if you're new to us, and if it's your first time tuning in, let me just sort of take a quick step back and tell you a little bit about what we're trying to do here. So we're really passionate around healthcare innovation, adoption, access, and leadership. And our focus is around bringing real stories of those that are actually innovating and doing the work and highlighting them and giving them the opportunity to share their story with our community and ultimately with the world. And if you haven't had an opportunity to check out any of our historical interviews, any conversations that we've had, please make sure you hit the subscribe button now so that any of the new conversations come directly into your inbox. In our field, things are always moving quickly. They're fast evolving, and it's crucial to have leaders that can envision a brighter future, that are eagerly embracing innovation, and they're actually doing something on top of it, most importantly, to actually address a lot of these pressing challenges. And our next guest on the show is one of these leaders. Today, we are very honored to introduce a visionary leader, Darren Schaupp, the co-founder and CEO of SiteLabs. So Darren's had an amazing storied career that spans over 25 years, and he's no stranger to the challenges and triumphs of nurturing groundbreaking initiatives in complex global environments. So Darren brings a very broad perspective, tackling some of healthcare's biggest problems, especially now around access. And his background is really impressive. It includes providing strategic direction and growth for the global transformation team at American Leprosy Missions, where he launched health and tech innovations to assist those affected with neglected tropical diseases. And he's not just about coming up with really neat innovations. Darren believes in creating a strong partnership and community engagement to bring about real change within healthcare from the ground up. So we're thrilled to kind of dig deeper into this, get Darren's insights. He can share some of his experiences and learnings around how he and his team are reshaping the future of healthcare. So Darren, welcome to the show. It's great to see you.
Thanks,
How are you?
Michael. Great to be here. Great to finally be on. I love it.
Yeah, so maybe we start off with, can you share a little bit about your journey into healthcare leadership and what drives you every day?
Sure. Yeah, it really starts being overseas. We have lived or worked overseas for much of the last 25 years with my family, and that included being in Kenya and Ethiopia. Two of our kids were born in Kenya. So in that time, there's so much that you learn from being in another culture, right? It's
Mhm.
not only the beauty of the culture, the richness and depth that you learn from, but you also see great needs and great challenges. And over the years and over the decades, that just grew from community engagement and community transformation. And I realized, even though my background was
Mhm.
studying anthropology and biblical studies and things like
Mhm.
that really what I loved was transforming business in a way that was viable. So
Mm.
how to make community development initiatives actually financially sustainable so that they could be sustained for the long haul. So take that from things like water and sanitation and emergency food programs to then getting more and more into healthcare. And eventually that led me into the field of leprosy with American Leprosy Missions. And that was transformational because you're talking about how do you reach some of the most marginalized people on the planet, those
Mhm.
that are at the fringes of the health system and of communities and have been pushed out, pushed away. And then there's just these huge logistical challenges, right? Like, how do you even diagnose somebody who's in remote parts of the Congo or in Myanmar? And so all of those things we just kind of were, um, yeah, it was like throwing meat to a bulldog, like I
Mm.
love tackling hard problems and especially ones where there's tremendous impact on the life of a person. So that was kind of my journey in brief into that space.
Amazing. And walk us through the moment where you decided to start Site Labs. What was the catalyst that shifted you from thinking about, hey, this is a concept, now I'm going to start executing? Well, talk us through that.
Yeah, it really started back when I was working in neglected tropical diseases like leprosy and leishmaniasis, Buruli ulcer, and I really started to understand the power of diagnostics and how if you can diagnose somebody early with a disease, it's transformational, right? Like if you know what you have, you can then seek care and get into a pathway that has a profound difference in your outcome. So, of course, we can kind of picture in our mind what that means for a disease like leprosy. But take what that also means for somebody with chronic disease, with diabetes, cardiovascular disease, with cancer. Like early detection is the gateway to health. So I knew from walking down this path and trying to solve problems in really challenging contexts that then translate that into the US. How do we do that here? So it was right at the year 2000. It probably terrible timing because it's
Mm.
exactly when COVID happened. So even though the vision was to be more global in our approach, because the border shut down, I was restricted to thinking, all right, how do we transform healthcare here in the US?
Mm.
Where are the gaps? Where are the people who are still underserved, marginalized, not getting access to care that they
Right.
need? And that was kind of the genesis, that background of like, how do we diagnose people early and how do we get that type of tech into the populations that need it most?
Yeah.
And so that's kind of the where it started there in 2020.
So so there's a few things that we're aligned on. Can you share a little bit about the purpose, the vision, the overall vision of SiteLabs? And then for those that don't really know about what SiteLabs does, maybe we can dig into that too.
Yeah, oh, I would love to, of course. So the vision for SiteLab is really about the 100 million people in the US who are at risk and unengaged in care. How do we transform access for that 100 million people? So
Right.
again, I learned so much over my career, and I'm just indebted enormously to the scientists and practitioners, community health workers across Africa and Asia that they were my teachers for decades in how to be creative and how to be innovative in environments where often you have such resource constraints. So there's not enough physicians, there's not enough money, and so one of the things that I learned from all of my colleagues was look for existing networks, look for things that already exist, and leverage those networks. Like that is your path to scale. So, overseas, that could be, and even here, that could be elementary schools or community health worker networks or sometimes women's groups, things like that, that you can tap into their local, hyper local expertise and
Yeah.
connections and then reach scale. So take that to the US and like, how do we reach this 100 million people? Well, there's a network in the US that's really underutilized, and it's independent pharmacies, like mom and pop pharmacies. And so most people think, oh my goodness, like, are we talking about the pharmacy like in It's a Wonderful Life, or
Hmm.
that
Hmm.
kind of thing? Aren't those dying off? But actually, they're not. That market is growing. Over the last 10 years, there's about 23,000 independent pharmacies in the US. It's one in three pharmacies are still independent. And interestingly, the number of chain pharmacies has been in decline over that same 10-year period. Really, it's counterintuitive to what most of us think. So this
Interesting.
is the network that we started to think about, like, let's leverage this hyper local trust that they have. They're the ones who tend to sponsor local little league teams in your community. They're very
Right.
involved. And the data shows that the majority are in what are considered socially vulnerable areas, which
Mm.
is exactly where we're trying to reach, right? And when I say we, I'm talking about health systems, health plans, accountable care organizations, pharma companies. They're desperately trying to reach this unengaged and at-risk population who are also have these barriers to access. So we just see this network as being really fundamental in helping change the game and transform access.
What's been profound in sort of our conversations leading up to this conversation has been around how pharmacies are perceived and leveraged and utilized in continents like Africa,
Yeah.
comparatively to how they're used here in America. Can you maybe talk a little bit about the contrast and how we're trying to create a little bit more of a paradigm shift towards what they potentially could do?
Yeah. Yeah. I mean, it's defining the way I think about innovation, right? Is borrowing from other smart people and then using it in a new way. And so part of what I saw in both Africa, Southeast Asia is they use pharmacies very creatively, precisely because they don't have enough doctors to serve the extent of the population that need care. So you can walk into a pharmacy and get a prescription. The pharmacist serves like a mini doctor in many communities.
Hmm.
And while
Hmm.
that has a lot of challenges, right? We all know that you have to be careful there. What we have in the US is an underutilized network. So you've got a plethora of PharmDs who have been trained clinically and are longing to practice at the top of their license. Like they want to do more than just fill vials with pills. And yet the regulatory environment in the US has been really challenging for that. So what was really interesting is COVID helped to break some of this open. It's been
Yeah.
in the process for a while with you look at vaccinations that have moved from physician's office into the pharmacy.
Hmm.
And then during COVID, you had, okay, we've got to do something different. Like the needs demanded a different way of thinking about it. So then all of a sudden you had more prescribing authority. So you could get a vaccine, but you could also get Paxlovid, that was administered and prescribed by the pharmacist. And that's what we call moving to test to treat, where pharmacies are allowed to both test for diseases and then treat them, the simple ones. So think flu, strep, RSV. Those are things that more and more can be handled by
Mm.
pharmacies in the US. And that's the direction that we have to go, right? There's not enough physicians. It's only going to get worse in the next 10 years. That's a huge headwind for the health system, but it's actually a tailwind for what we're doing in leveraging this network to provide more accessible care.
So interesting. So talk about today in terms of how you're working with health systems. What does that look like? You mentioned a few different constituents, but since health systems was sort of at the top of your list, I'm curious, what's that relationship, that collaboration like?
Yeah, I mean, well, first it was really identifying what are their needs, what are their pain points that they have. And one consistent one that we've heard from many health system leaders is, well, I'll give you a really clear example. In North Carolina, in one of the communities we work, they've got zip codes where 85% of the population are not coming in for care. So
85?
they
85.
85% of the population, yes. And it also happens to be the poorest segment of their population in their catchment area, and yet they only live a mile from the main hospital. They also have
Wow.
rural communities where this is true, but most of us don't think that these urban and peri-urban areas can be profoundly underserved or they underutilize the available services. So what this means for the health system is, number one, they've got populations where the disease prevalence is at its highest and it costs the health system the most, and they're also not coming in for any kind of preventative checkups or screenings. This is a consistent problem across health systems. It's really what I talked about at the beginning, that at risk and unengaged. How do we reach that population and really build trust and break down barriers to access? Like, that's what we want to do. And that just gets me super excited. So
And and
part of
and,
it
and
was
what is
really
it?
identifying the need.
Is it the fact that, maybe some of these buildings are are people scared to go into a hospital? Are they just that what's the word that I'm looking for? And it's escaping me. Darren, help me here.
So, well, it's complex, isn't it? Right? When you look at,
Yeah,
if you do a barrier analysis of why people are not utilizing services that are accessible. So, what often comes, trust is often a big one. And
yeah,
especially in minority communities or underserved communities, that can be a big one. Um, then there's also just something like transport. Even those who are reasonably close by, it can still be a barrier to getting into the health system.
yeah.
Another one is frankly just how long it takes to get a physician's appointment. So
Hmm.
just recently, I was trying to move my doctor from Greenville, South Carolina, which isn't too far away, to Clemson, where we live. And I was put on a waiting list for 8 months just to move my primary care provider.
Eight
And that's
months.
me as middle-aged white guy who's got some resources to pay for a doctor visit and insured. Like, imagine what it's like for somebody who's on Medicaid. Like, they should have good access, but often in practice, it is a barrier
Mm.
to really getting into a timely appointment. So I'll give you a story, quick story. So
Yeah,
not too
please.
far in this North Carolina area, there's a young guy, I'll call him Jahim. So he comes to one of our pharmacies for a wellness screening, and that's our model. And this will describe what our model is. So this is a free wellness screening sponsored by, in this case, Cone Health in North Carolina. That it's a small to mid-sized health system. So he sees this, he comes in. He gets screened, he gets his A1C done, his cholesterol, his blood pressure, BMI. And I asked him that day, I said, like, Jaheim, why'd you bother to come in and get this done? He said, well, my parents both have diabetes and they've been bugging me to get checked out. But man, I can't afford to take time off work to go in there. And it's a hard to get an appointment. But this was so convenient. I could just walk in off the street and get it done. It was great. And I've heard that over and over that this idea of convenience just it lowers a barrier in there, whatever those barriers are, whether it's the frustration, it's missing work and not being able to afford to take time off work. And so that's part of what we just say proximity and the availability and accessibility of independent
Yeah.
pharmacy. Like you can walk in and talk to a pharmacist off the street. When's the last time you could do that to a physician? Like, when?
Hardly.
Yeah.
Hardly if any. So then Jahim comes in,
hmm
does his diagnostics. What happens then?
So then he gets the results straight to his phone or his email, and then the pharmacist has like a 5 minute consult with him. So the screening takes maybe 15 minutes total of his time. Um, and he has the results, and the pharmacist will talk to him and say, "Hey, Jahim, looks like that they don't diagnose, right? That's not in the
Hmm.
pharmacist's
Hmm.
purview. But here's some of your values here that are higher, they're elevated. We really recommend that you see your local PCP, your primary care provider. Is
Yeah.
you have somebody that you see regularly. And so Jahim may say, well, I see Dr. Smith down the road. So no problem. Our system, we can they just plug it into our system and it sends a secure fax to Dr. Smith. We also have a follow-up sheet that's provided to Jahim that can be for him or any of his family members at home. And it's so for the sponsoring health system, there's some options there, like virtual care, just scan the QR code and you can have an appointment right away. Or you can make a reservation or an appointment at these facilities. But we also provide non-sponsoring health system options. So it truly is patient choice. And that's part of just really important in terms of compliance and maintaining that integrity of the patient choice in the follow-up. So it's really what the pharmacies do and what the health systems pay us to do on their behalf is engage the local community. So do outreach to people like Jahim, and there's 100 million people like that. Screen either at the pharmacy or
Hmm.
they'll screen on site at a local employer. One of them just did the North Carolina Zoo, which is fantastic. And then refer. How do we connect a patient to care, which ultimately is what's in that patient's best interest? Like, man, Jahim needs to know if his numbers are elevated. And so, because it's not like he doesn't want to know about his health or take care of his health. It just needs to be accessible.
What have been some things that you have seen throughout this process that have really surprised you? Because you mentioned this staggering statistic around a number of folks that aren't able to get in to visit with their physician,
Mhm.
and yet they live a mile or less away from a medical center. That's wild. What
It
has
is.
been pleasantly surprising for you to see throughout this process?
Well, there's so many things on it. One of the first things is we knew from working with independent pharmacies that there's this hunger to practice at the top of their license. But
Yeah.
that level of adoption and excitement about being engaged in the forefront of clinical services like this to really expand the types of services you can offer to your community is just so energizing. And not all of them want to do it. Like, totally get it. But we found that 90% want to do it. About 30% are prepared right now to do it. Like they've got a private room for consultation, that sort of thing. So we do grade them on all of these things. But that's been like this joy and surprise is how eager they are. We had one pharmacy last month, they did over 500 screenings just by themselves. They went
Really?
out and bought a van and wrapped it in and just have this air conditioned screening, mobile screening unit that they take to local employers. And it's just like it's been over the moon what they've done. So that's been cool. And I would say another thing is just who we're finding. Um, I remember being at one employer. This was a concrete company. They have about 400 staff. They called up the local pharmacy and said, "Hey, we hear you're doing these free wellness screenings, sponsored by Cone Health. Could you come do it for our team?" So I was there on site for that, and this one guy, I'll call Manuel. He and most of the team there are Hispanic. They're all insured, but over 40% do not go to any primary care provider or go in for a visit.
Do they
And
reveal why they don't?
yeah, that's part of what we asked them, right? And so
Mm.
a lot of it is just convenient. It's too much trouble, can't take time off work. Those are the big ones that we hear. But what was interesting about this, and this is part of what's encouraging, is his blood, he was in hypertensive crisis, which means his blood pressure was severely elevated, could have a heart attack or stroke at any moment.
Whoa.
And what was incredibly satisfying is seeing the pharmacist have the consult with him. And this is a guy in his mid 40s. He's got young kids at home, and just his face changed when he realized, like, this is life or death. And just by coming in and getting screened, like, this is where public health becomes super personal, right? It
That's right.
is about Manuel's kids, their future. Are they going to have a dad around? And it just hit him like a ton of bricks. And then we could get him, make sure he gets into the emergency room, or urgent care. It's his choice on that, and have follow-up care. And that's, yeah, well, just as a statistic, out of the 2,000 or so people we've screened in that area recently, about 100 have been in hypertensive crisis. Like 5%. Think about that. 100
Wow.
people who could have a stroke or heart attack at any moment. Really profound.
Wow. So then what have been, I mean, these are great. What have been some of the biggest challenges that you and the team have faced? When you're trying
Oh,
to deploy a new
just
model.
the
I mean,
biggest ones.
yeah. It can't
You
all be
know, I mean,
wins,
I
right? It
think
can't all be wins. There's obviously a lot of
no.
learnings
Oh,
here.
I
Everyone trying to
wish.
get as
Oh,
real
I
as
wish.
possible.
There's so many challenges. I mean, there's just the operational challenges and logistics in the community. Unfortunately, that's where I cut my teeth, right? Is operating in very complex environments. So think of refugee camps in Sudan and Somalia and like, I mean, some challenging areas. So it's a little bit easier than some of those. But it's still a challenge to make sure how do you get communities involved? So how do you get the word out? And
Mm.
people still have a lot of trust issues. Like, well, what's the reasoning behind this? Why are they offering this free? Like, what's the catch? So that's always a challenge that you just have to take time
Yeah.
and build trust. The other one is structural in those enterprise level relationships. Anybody of your audience who deals with enterprise sales contracts and you're talking to P&L holders who have a lot of different responsibilities, oh my word, is that an uphill battle, right? Like
Hmm.
they've got a lot of priorities. This is always among their top priorities, but to get that attention and say, we are going to pull the trigger and make this a program. Um, yeah, that's a huge challenge.
Well, as you were talking and sort of illustrating what this could do, when you think about a lot of what's happening right now in the space, expansions, uh, opening up footprints, it seems to me that this is a way of not only being able to use intelligence, but actually using intelligence where people are raising their hands saying, yeah, there is a need here. to then go
Right.
and build brick and mortar. How do you describe, how have the health system partners viewing that? Is that something that they see as a significant advantage, knowing that they're no longer just looking at data on a screen, rather they're actually seeing patients that are funneling their way through and making their way through back into the health system? Well, talk a little bit about that and
Mm-hmm.
what that means from a health system standpoint, because
Mm-hmm.
there are obviously some financial implications there.
Yeah, they're pretty significant, honestly. That's actually one of the things that pushed one health system over the line is when they were in their final executive session about deciding on this program and the value that we bring. It was really instructive. The chief medical officer stood up and said, "What makes this a no-brainer is that we could spend $5 million building a new clinic, which is CapEx expense, and we don't have CapEx to spend. We're struggling there. Or we could spend $5 million with SiteLabs in an OpEx expense and be in 100 different locations that already have brick and mortar and capturing patients and real-time, real-world data." He said, "This is a no-brainer for us." And that
So,
was that was like a wake-up call. Like that frustration and challenge that health systems are facing about where do we build? How much do
mm,
we build? How do we make this sustainable? Push it down the road a little bit, and one of the P&L holders said, "We see this as ultimately a hub and spoke strategy. You're out there, you're screening patients, getting us real-time, real-world data. That helps us know where to build the next clinic more efficiently. And then that becomes a hub, and the pharmacies are like spokes around there that are continuing to screen and capture patients." So that's super exciting, and it's different than the way health plans think about it in closing gaps. But it's the same idea. We think of it as leveraging this network as a platform for services. That's what will reach 100 million people and truly transform access.
that's tremendous. Let's talk a little bit about, you've spent a lot of time in different complex environments, and that's shaped you.
Sure.
What do you look for in team members, and how can you discern and tell whether
Hmm.
they have that ability to be resourceful, to be adaptable, to be in difficult situations, and yet still have that creative prowess to make stuff happen?
Hmm. Yes, yes, yes. I love this part. So part of what I enjoy is trying to discover what somebody's true gifts and strengths are.
Mm,
Because what I've learned over the years is it doesn't matter what your training or education is, the jobs that you've had necessarily, those of course they matter a bit. But ultimately, the way that I think about strengths and gifts is what is it that the person can't help but do? And that's what they tend to do in whatever job they're in. And that's what I look for in who we hire is is does their strength and gift really align with what needs to be done? So
mm,
um, I'll give you an example that we had. You'll have a variety of people, like you think about accountants, for example, and there's an accountant type of personality that tends to be true, like that they're finding what's wrong in the numbers. They're spreadsheet jockeys, but they tend to be what they might call the Office of Sales Prevention.
mm,
Like they don't think about how to drive the business forward. So when you find somebody and you're looking for somebody in finance, but you see that what they can't help but do, and I just talked to somebody about this like this recently, and their bias was all about, okay, I get it. So how do we do this differently? How do we do this and really drive the business forward? Not how do we mitigate all risk and make sure that nothing happens. I don't know if that distinction makes sense in terms of
it
the
does.
accountant.
It does.
Big difference in how you work with that person on the team.
Also, in identifying the talent of the team and harnessing that, bring that up. What do you think about in terms of what advice would you give to other folks that are trying to forge collaborative partnerships, productive partnerships? What advice do you give to those healthcare leaders?
Hmm. I would say, first of all, make sure that there's a history of collaboration for that person. And that's when I think of what somebody can't help but do. Like if they have a history of collaborating and working with, then they will do that again, no matter what their role is. Um, and I mean, of course, you know some of my biases. Like if we don't collaborate and work
Yeah,
together, it's
yeah,
never going to get done. Never.
yeah.
And so how do we think in terms of one plus one can equal three? And and part of that is honestly willing to give up some of your own kingship, right? Like you can't own it all. You can't always have your name or brand on it. You have to, if you're going to be collaborative and really get something massive done, like 100 million people, then you've got to work um, much more open-handedly with a lot of other people and let
Yeah,
other people get the credit sometimes. Like that is a real win ultimately for the mission.
totally agree with you there. It's okay to let others, have the spotlight on them as long as you're aligned on what the mission is. And curious,
Mhm.
just even around your ability to be productive and focused, are there any, routines or habits that you credit for being able to maintain such a high level of focus and productivity?
Oh, man, I always think about what I can do more. Um, are you familiar with the Strengths Finder by Gallup?
Yeah,
So
yeah.
focus is one of my top strengths, and so it is something that I can do. I can zero in on a task, and it can be a fault for sure. Um, but I tend to I love lean experimentation, that type of process. So I do take small bites and just keep chipping away at something. So that's part of how I keep my focus is here's what I can work on today. Here's what I do today and move the ball forward. So it's just a little bit of my personality. Whether that's a great way to do it or
Mhm.
not, it's just that's
Yeah,
me. That's the way I've
works for
found to
you.
work with who Darren is. Yeah.
So how can folks continue to follow you, your work, the work of SiteLabs? Maybe give us a little bit of a commercial on what that looks like.
Sure. Yeah, I would love that. So sitelabsglobal.com is our website, but just keep in mind that we're still in stealth mode in this health system model. So it is focused on pharmacies right now and how we serve them. That is changing bit by bit over the next few months. And then keep an eye on blog posts. Follow me on LinkedIn. You'll see some announcements from now and again through LinkedIn. And as you can always reach out, info@sitelabsglobal.com. If you're a health system leader, a pharma leader, health plan leader, and you're trying to figure out how to reach this 100 million people, let's absolutely talk. Would love that.
Amazing. And then just as we wrap up now, I mean, what's one, we always talk about taking action. Innovation is around action and execution. The best innovators are often the best executors. What's one action that you want to leave from this conversation that someone can take, especially those that are looking to make a difference in community health?
Hmm. All right, so this goes back to my anthropology training is go as a learner. Like this week, do something that helps you learn more about the people, the product, the customers that you want to serve. Learn something about them. So go as a learner and figure out, because most of us act too fast. We build too fast, we move too fast, and we really don't ask enough questions and learn before we step into the space.
That's amazing. Go as a learner. So, for those that have tuned in, if you found this particular conversation to be helpful, if you learned something, my small ask is this, would you mind sharing it on social, liking it, commenting on it? What stood out to you? What are you going to implement? We want to know that. That feedback's incredibly important for us. And, as we try to build a vibrant community that wants to move things forward, it's about collectively doing stuff together. So Darren, I'm grateful that you were able to come on, share a little bit of your story. Obviously, you're always welcome to come back and share what these next chapters of the journey look like. And thanks again.
Sounds great. Thanks, Michael. Really loved it.